So it's 9 p.m. now. I believe for the people who have attended at time, we can start, at least by the introduction. Okay. Can the audience please keep their cameras and mics off? Okay, so Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good evening, everybody, for attending with us the webinar today. First of all, thank you to all of you who have attended on time, and I'm sure a couple of people would be joining in. I would also like to say many thanks to our Medical Development Center, who are very active here at Al Salam International Hospital, always keeping us abreast with all these webinars and these scientific activities. Thank you very much. Today, our webinar is about a very interesting topic, sport and the heart, and will be given by a very well-esteemed speaker and colleague, Dr. Islam Mahrouz, who happens to be the consultant and chief of the Heart and Vascular Center at Al Salam International Hospital. Myself, I'm Dr. Sania, specialist internal medicine. I will be here to moderate the session. Just few housekeeping things before we start is that please, I request all participants to turn off their mics and switch off their cameras. And if you have any questions, and I'm sure you would be, please write them down in the chat box. And I'm sure Dr. Islam would be happy to answer them at the end of the session. The main objectives of today's interesting topic is to discuss the updated European Society of Cardiology guidelines of sport guidelines of 2020, and to discuss and how to minimize the risk not only in highly trained athletes, but also to protect other population who join sport and might have heart diseases. Thank you very much. Dr. Islam, over to you now.
Thank you so much, Dr. Sania, for this very nice introduction. I will also need to thank all of you for attending the presentation tonight. It's really a pleasure to me to be with you tonight in one of our CME activities in the Salam International Hospital, Kuwait. Initially, I would like to thank again the Educational Department in SIH here in general, and Dr. Aruba Al-Musallam in a specific, who did all effort possible to get 2 CME points for this lecture. So without any further ado, I'm Dr. Islam Mahrouz. I'm intervention cardiology consultant in the Salam International Hospital, Kuwait. So today I will discuss with you a very important subject that almost every one of us is touching in our daily life activities, which is sport and heart. I don't have any conflict of interest. So my agenda for today, it will include the following: a brief introduction about sport. Secondly, do we need any new guidelines for sport and athletes? So what about the safety of a sport? Is it always safe to go for a sport without being investigated? Then we will discuss some medical problems that might be related to sports. And eventually I'll give you a take-home message. So please stay tuned. So let's start with the introduction without any further ado. I'll start my presentation asking you a very nice question. Who is your favorite athlete? So I'm sure that every one of us has a list of favorite athletes. So let me give you my list. My list is always starting with one of the legends in the field of boxing. This is Muhammad Ali Clay. Muhammad Ali Clay, he is the heavyweight champion of the world for 3 times separately. And to my knowledge, this is the only man in the earth who had the title for 3 times on 3 separate occasions. He is one of a kind in the history of boxing. Muhammad Ali, he got the title in a very young age after beating and sending Sonny Liston to the campus in 1964. Then Ali defended his champion in 1965 against Liston as well, and he deserves to be the champion of the world. Ali was not only known as the heavyweight champion of the world, but he was also known for his strong and constant political opinions. Upon one of them, the title was taken from him. Then again, Clay came in 1974, and he got his title back after beating George Foreman in Zaire in 1974. So, and I'll let you to enjoy this match and the knockout of George Foreman by Muhammad Ali Clay in Zaire in 1974, and getting the title again for the 2nd time in his life. So my second one in my list is Ramy Ashour. He is one of the best squash player ever. I think this is a legend. He is the best man on the earth who touched the squash racket. Ramy Ashour is one of the most magnificent players in Egypt, and you can see clearly one of his fantastic game against Gaultier one. He is a French #1 player. Ramy Ashour was not only playing squash, but he was just like playing music in the middle of the court, as you can enjoy now, one of his points. Now, Ramy Ashour retired, and he is turned into a singer, a real singer, and he has also his private center for training of junior squash players in Egypt. So my last one in my list is Mahmoud Al-Khatib, or Bibo. I think he's very well known to most of the Egyptian colleagues who are attending this presentation today. So Bibo is the best African player in 1983. He was retired in 1986. He's currently the president of Al Ahly International Club in Egypt since 2017 until the current. In my opinion, he's one of the best players in the whole world. So now you know my list, and you know my favorite athletes. I'm sure that every one of you might have his or her own list of favorite athletes. But who is athlete? And let's jump to my presentation now. So we have different definitions of athletes. Actually, we have 3 different types of athletes. We have elite athlete, and this is the one like, for example, Mohamed Salah or Mo Salah, our Egyptian phenomenon, who is practicing at least more than or equal to 10 hours per week. We have competitive athletes who is practicing for more than or equal to 6 hours per week. Like, for example, high school or university players. And finally, we have recreational athletes who is participating or joining some sports for more than or equal to 4 hours per week, like most of us or some of us who are going to the gym occasionally. So let me give you this question. Does physical activity always means exercise? Of course not, because physical activity is any body movement that produced by the skeletal muscle that eventually will result in energy expenditure. So even this penguin at the photo, they are doing physical activity. So what about exercise? Exercise is a repetitive, purposeful activities to improve or to maintain one of the components of the physical fitness. And what are these components of the physical fitness? We will know in a while. So the physical fitness include the cardiac and the lung function, the morphology of your body, including the fat, the muscle mass, as well as the bones, the muscle power, the metabolic activity of your body, like glucose or lipid metabolism, and finally the motor function of your body, including the balance, the speed, and agility. So what are the determinants of the physical fitness? First of all, let's start with the oxygen absorption, then oxygen delivery to the tissues, then oxygen uptake by the tissue, and finally the metabolism. So what are the physiological adaptations to exercise? You can clearly see this cartoon of two echoes of a normal person. Some people who are going to do some physical activity, especially for heavy weightlifting, unfortunately, they might develop what we call left ventricular hypertrophy. As you can see clearly in the video, that the thickness of the muscle is markedly increased here. And not only that, but also the volume of the left ventricle and right ventricle, they are also increased proportionally to the amount and the time of the sport that you do, especially if you are heavyweight gym, heavyweight lifting. Not only that, but also the aorta is dilated, as you can see in this cartoon. This will come at the expense of the compliance, or what we call the relaxation of the ventricle. And by this, I finished my introduction. Let's jump to the next point. Why do we need new guidelines? So the one who is going to answer this question is Kano. He is one of the best Nigerian player ever, and who said in 1996, knowing that being fit and strong doesn't always mean that your heart is 100% fit. And this when Kano discovered that he had a valve heart problems and he had to go for a surgery, despite that he was one of the best Nigerian players. So in 2005, we had only some recommendations for competitive athletes with cardiovascular problem. And that was followed by some updates in 2019 and 2018. But in 2020, we had, for the first time, released by the European Society of Cardiology, the first comprehensive guidelines for sport. It was first of a kind, and we started to hear about this novel specialty, which is a sport cardiologist. But let's go back to the question again. Why do we need new guidelines? So the aim of these guidelines was to minimize the risk, not only for high-trained athletes, like Big Ramy, for example. This is our Egyptian bodybuilding champion, who currently won the world champion for two years, for the last 2 years. But it's also to protect other population who might suffer of cardiovascular disease. So as you all know that sport is just like any other thing in our life, it carries both risk and benefits. So let's talk about the benefits of sport. Sport is just like any treatment. So it will protect your heart. So it will decrease the cardiovascular disease. It will decrease mortality as well as malignancy. And this is something proportional. So the more sport you do, the more protection you have compared to a sedentary life, man. So unfortunately, this is not always a risk-free. And here in this presentation, we are not talking about this kind of risk, like, for example, fractured tibia or fibula, or having a face injury like Cristiano, but we are talking about a major acute cardiac event. What are these major acute cardiac events? Oh, exercise can cause fatal arrhythmia, like sudden cardiac death or sudden cardiac stop of the heart function. So like ventricular fibrillation, as you can see in this cartoon. And this is most probably what happened to Muhammad Abdul Wahab, one of our Egyptian players in Al Ahly club, who died in 2006 suddenly in the middle of the court. Or like Marc-Vivien Fournier, who died also inside the court in front of everyone on the camera on 2003. That's the risk that we are talking about here in this presentation. And that's why we need new guidelines for sport and athletes. But please don't panic, because the major acute cardiac event is not as frequent as you might think. Some people, they need like 100 years of doing vigorous activity to develop MACE or major acute cardiac event. And the risk is always in the first 1 week of starting physical activity. especially the vigorous one. So we always advise people to go gradual in both duration and intensity. And like what Italian always saying, piano piano means you go gradual and then increase gradually. And this is the way to go to sport. So as you can see in this cartoon, you might start up with 30 minutes of simple walking or even slow jogging, and you might end up within 3 or few months by doing 3 hours of continuous long running. So, but you have to do it gradually over a few months. So what about all the people who are very well trained and they want to practice some vigorous exercise? Do they have an extra risk? So I'll give you an example of this. Fortunately, they don't have any extra risk. And to give you an example of this is Mike Tyson in his prime. He was in 20s, and he was the heavyweight champion of the world in boxing. And you can see clearly how much fit he was. This is Mike Tyson after retirement. You can clearly see his belly and how much weight he gained. This is Mike Tyson again at the age of 50. You can clearly see that his six packs are back again. And this is one of his exhibitional match for Tyson at the age of 50 with Johnny Rhodes, one of the best boxer players. You can clearly see and notice how Mike Tyson is still keeping his speed, movement, power, flexibility, fitness, and his skills. So he doesn't have any extra risk because he's well-trained athlete. So what are these MACE, major acute cardiac events? What are these MACEs? So we will discuss this in a while. So the most important one is sudden cardiac arrest or sudden cardiac death, and we will know the difference in a while. Acute coronary syndrome, TIA or cerebrovascular event, supraventricular tachycardia. Of course, the most important one is the first one, which is sudden cardiac arrest or sudden cardiac death. What are the difference between them? So for the sudden cardiac arrest, this is unexplained collapse. So means that the athlete, he is suddenly collapsed and the heart stopped to pump, and this will suddenly happen. This might be due to asystole, so the heart stopped completely, or due to ventricular fibrillation. He might need a CPR for the first case or a defibrillation for ventricular fibrillation in order to come back again. So what about sudden cardiac death? The sudden cardiac death means that the victim is dead already, and most probably this is due to a cardiac cause, but you might be astonished if you do autopsy for such patient and you find nothing at all. So in most of times, arrhythmia is the victim or is the leading cause of death in such cases, like what happened to this player in the middle of the court. So sudden cardiac death, who is more liable? If you are going to join a sport, am I liable to have a sudden cardiac death? This is a very important question. So it's really, the incidence is very variable. So it's varies ranging between 5,000 and 1 million. It's higher in males with an incidence of 3 to 9 male to 1 female. And it's also higher in blacks, like what happened to Mark Vivian Foyer, as we mentioned before. It's also higher in basketball and football players. This is a very vigorous sport. If it happens below the age of 35, most probably the leading cause is genetic or congenital problem. But if it occurs above the age of 35, most probably it is due to atherosclerotic coronary artery disease. And this cartoon can see clearly this difference. So if you have a problem before the age of 35, you gotta always think about congenital problems. But above the age of 35, as you can see here, in 70% of people, they might have a coronary artery disease. So now I finished, why do we need new guidelines? And now we are talking about the safety of sport. So this is a very important question by everyone. He might come to your clinic, doctor, is it always safe to go to start sport? Of course not. So why? We have to go always for screening. And this is a team work. So this is including nurses, doctors, and technicians who need to screen the patient before joining the sport, especially if it's a vigorous sport. So how we do the screening? If it's below the age of 35, so we have to go for a comprehensive history taking. This is including the risk factor like hypertension, diabetes, cholesterol, or smoking, obesity. So we have also to ask about any chest pain or unexplained syncope, or if the patient is experiencing any dyspnea, palpitation, or marked fatigue, there was any prior murmur before, any restriction from the sport, and what was the cause of this restriction? Did this patient had any previous testing like a treadmill or echo, and what was the result of this test? And then we are going to check the family history. So we have to ask about if there is any family member in the family who had sudden cardiac arrest or sudden cardiac death before the age of 50, there was any disability in the family for a heart problem before the age of 50, there was any family history of HOCM, dilated cardiomyopathy, long QT syndrome, or Marfan syndrome, or any kind of fatal arrhythmia in the family. That's very important. Then we move to the clinical examination. And the clinical examination should always include the hemodynamics. We check for any heart murmur, especially for the aortic problem. We check for the femoral pulse and any signs of Marfan syndrome. Then we have to go for an ECG, which is very important before joining any vigorous sport. And we might need plus or minus echocardiography in this age group. So what about if the one who wants to join a sport is above the age of 35? We exactly do the same. So we'll take a full history, we do physical examination, we have to request an ECG. Echo here is mandatory. Plus, we have to always ask for a treadmill test in case that we have symptoms, especially if we have chest pain or we have high-risk athletes. So you might ask me now, who is the high-risk athletes? And the European Society of Cardiology, they summarize the risk of anyone to 4 different categories, including the very high-risk people, high-risk people, moderate risk, and low risk. And I will let you to go through the table to know exactly what's your risk. So if I know my risk, what else I have to do? So first of all, you have to know your risk, whether you are low, intermediate, high, or very high risk. So if your risk is low, so you don't have to do anything at all, but you don't need to go for any investigation. So you can go to join any sport and to do any kind of a sport as much as you want. So what if your risk is high or very high? So in this condition, it depends on the type of sport that you do. If you are going to practice a low or intermediate intensity sport, like for example, walking, jogging, like a golf, tennis table, like that, so you don't need any further investigation. But if you are going to have a very high or high intensity sport, like for example, if you're going for a squash, competitive sport like football or basketball or water polo, for example. So in this condition, you have to be investigated first. And what are kind of investigations? You have to go for a treadmill test, or perhaps you have to go for also an imaging like stress thallium or multi-slice CT scan or MRI. If these tests are normal, go for a sport without any restriction. But if these tests are abnormal, so in this condition, you have to go for an invasive coronary angiography. Okay, then what else you have to do? You have to go to visit this guy. This is a sport cardiologist. So he will give you what we call exercise prescription. This prescription is not including any medication, but it has a lot of advices. So he will give you the frequency, the intensity, the time, and the type of sport that you have to do. This type including isometric exercise or isotonic exercise, for example. So he will also discuss with you how much calorie you have to gain and how much calorie you have to spend. So let me give you this very nice question. How much calorie do you think you can burn in 30 minutes of squash, like the match you are watching now on the video? So let me answer this question. It's almost 517 kilocalories. So next question. How much calorie do you think or you might gain after taking double Mac burger sandwich without any dressing? It's 550 kilocalorie. So as you can clearly see that here and clearly in front of you, that you need 30 minutes of vigorous exercise like playing squash to burn one burger sandwich that you might finish in 3 minutes. And this is type of information that you have to discuss with this sports cardiologist. So now I finished safety about sport and safety issues about sport. And now we will discuss some few problems that might be related to sport, starting with obesity, silent killer, diabetes, dyslipidemia, and finally ischemic heart disease, which is one of the most important and dangerous diseases with sport. So let's start with obesity. So the definition of the obesity, as you know, that it's the body mass index is more than 30. And here this graph is showing different types of obesity scale, starting from normal, overweight, severe, morbid, and super obesity, according to the body mass index. So we can also know the obesity, not only by the BMI, but also with this waist circumference, which is more than 94 in males and 80 centimeters in females. So if I'm obese, what shall I do? So it's a must to go for exercise at least 30 minutes, 5 to 7 days per week. 3 days of them, you have to do resistance training like heavyweight carrying heavy weights. Again, the requirement, 30 minutes, 5 to 7 days. You have to do moderate intensity endurance, like fast walking, running. You have to do 3 times per week resistance exercise. Aqua fitness is also very helpful because it carries your body with you. So the water will be very beneficial for you. So what are the good effects of exercise in obese patients? First of all, it reduces the intra-abdominal fat mass. It increases the muscle power and the body mass. It will reduce your blood pressure. It will improve your cholesterol. It will improve your diabetes. It will reduce any chronic inflammation in your body, improvement of your fitness and breathing. It has a very good positive influence on the maintenance of the weight reduction, the general well-being and self-esteem, and reduction of the anxiety and depression. So the same that we did before, you have to know your risk. If you are having any kind of risk and you want to join high intensity or very high intensity sport, you have to go for imaging technique first. But you have always to be cautious. Obese patients running an abrupt increase in the training, it might cause some skeletal muscle injuries. So please stop making excuses. This is very important for all obese, because you can do it even at home. You have a lot of exercise that you can practice at home without any financial burdens, without any fancy gyms. This is not a dream, guys, because you can make it true one day. So now moving to the silent killer. And the silent killer, I don't mean here this snake or cobra, but I mean the hypertension. So the same as we mentioned for obesity. So for hypertensive patient, they have to go 5 to 7 days, 30 minutes, including 3 times resistance training. This will decrease the systolic blood pressure by 7 millimeter mercury and decrease the diastolic blood pressure by 5 millimeters mercury. So, but those who are having hypertension, they have to control their blood pressure first before going to sports. And what do we mean with end organ damage? Those are having hypertension with left ventricular hypertrophy, diastolic dysfunction, arterial wall thickening or atherosclerotic plaque, hypertensive retinopathy, or kidney problem, so they have to control their blood pressure first before joining sport. So if your blood pressure is more than 160, you have to avoid high intensity sport, like as we said before, competitive football or basketball or water polo or squash. You have to control. You get your blood pressure very controlled before you join these kind of sports. So in this context, avoid also the Valsalva maneuver sports, like for example, heavyweight lifting, because you might end up with a syncope, as you can see in this video. So during sport practicing, you have blood pressure follow-up is very important, and you might need also the what we call ambulatory blood pressure monitoring to see if your blood pressure is getting control or not. So if you need to join a high intensity sport, as we can mention, so you have to go for the same assessment as we said before, as we mentioned in the obesity. So as you can see here, the treatment test is being done for this guy before joining sport to make sure that his heart vessels are okay. And you can see clearly here that the cuff of the blood pressure is attached to his right arm. So if blood pressure is not controlled, don't go for this test until your blood pressure is less, especially the systolic blood pressure is less than 160 millimeter mercury. So one important question now, how can I get my blood pressure controlled? This is a question by an athlete. Suppose that I'm hypertensive and I need to go for a sport. What shall I do? So first of all, we always start with non-pharmacological measures, means non-treatment. So this is including restriction of the salt. And you can clearly see here in the photo that 77% of the salt is included in the processed food or junk food. So please try to avoid it. The second thing that you have to drink a lot of water. If you want to know how much water that you have to take per day, you divide your body weight by 30, and this will give you the numbers of liters that you should take every day. So you have to reduce your body weight if it's possible. You have to go for a very balanced diet, especially the Mediterranean diet, and stop smoking. That will help in reducing the blood pressure. So if not, what else I have to do? In this case, I have to go for a medical treatment. So what are the medical treatment that we can take while we are doing sport? So the list, including the most three beneficial one, are the ARBs, the ACE inhibitor, and the calcium antagonist. So we still have a different type of medication. So why are not using, for example, diuretics or beta blockers? So unfortunately, the beta blockers has been abandoned by several sport institutes and societies because they find that, especially for shooting competitions, because they find that people who are receiving beta blockers, they have more neurological stability compared to those who are not receiving. So they find it unfair to give some players beta blockers, some others not. So that's why it's completely prohibited by these societies. So what about the diuretics? Why should the athletes should not take any diuretics? Because it's really inconvenient, as you can see in the photo. So because sometimes I have to leave the field for a couple of minutes to go to find the nearest bathroom because of the diuretic effect. Not only that, but it might cause dehydrations. So in the middle of the court or in the middle of the game, I have to leave the game to drink water. Then this is also sometimes it's not good. So now talking about the third problem that might face the athletes, which is diabetes. The lack of exercise, unfortunately, it causes 50 to 80% diabetes compared to active persons. Diabetes can cause a problem in the muscle strength as well as the joint mobility. Not only that, but it can badly affect your heart, not only the big vessels, but the small vessels, and we call it a microvascular dysfunction. So I'll give you an example of this. This is one patient with a normal right coronary artery. And this is one of my patients that I did in the Salam hospital. So you can clearly see that the artery is dilated and the flow is quite slow, and we call this one slow flow phenomena. And this is a diabetic patient. So what are the benefits of exercise in diabetic patients? So the exercise can improve the glycemic control. So it will lower your blood sugar. It will reduce the visceral fat. It will improve the insulin resistance. So the insulin will be more effective. It will cause prolonged adaptation to skeletal muscle and adipose tissue. So it will reduce the mortality in both types of diabetes, type 1 and 2. The exercise will prevent the progression also of the pre-diabetes to diabetes. So the same as we mentioned before in hypertension and obesity, you have to go for 5 times to 7 times in a week, 30 minutes. So you have always to be cautious because in diabetic patient, hypoglycemia might occur while you are in the middle of the game. And you might have also a chest pain. So in this condition, you have to go to check yourself. So what about dyslipidemia or high cholesterol level? So the sport will reduce the triglyceride by 50%, but the triglyceride is not as dangerous as the low density lipoprotein. Unfortunately, the sport is reducing only 5% in the LDL. And it might increase the HDL by 10%. This is a good cholesterol, the HDL. The LDL is the bad cholesterol or the bad guy. So the sport will shift the LDL small to low density lipoprotein to a large one. So it will be less dangerous. But is this enough? Of course not. That's not enough. So therefore, dietary guidelines as well as treatment is very important to reduce the primary and secondary cardiac problem. So eating very well is very important. And if this is not enough, so you have to go to take some medications like statins or omega-3. And if this is not enough, so we have due to back pain or increased liver or muscle enzymes, so you have to go for other facilities like, so the muscle pain, unfortunately, it might cause this problem. You have to go to ezetimibe or what we call Ezetro, or you have to go for an injection, which you take every 2 weeks, which we call PCSK9 inhibitor, or the new treatment that under trial now, and it's proved recently. This is like a messenger RNA, like a vaccine that we take 2 times in a year. It's very, very effective. So what about the Skinicardi disease, which is one of the most dangerous and most important problem for athletes? And this might be the leading cause of death in some athletes. The coronary artery disease, the problem that we have, atherosclerotic problem, which might be chronic or acute. And this acute, it might be unstable angina or STEMI or non-STEMI. And we might have other problems like abnormal origin of a coronary artery. This is a congenital anomaly. Or we have what we call myocardial bridge. And we will see this in a while. So let's discuss the chronic problem. I'll give you an example of this. This is a real scenario that you might face in your clinic. If you have Mr. Superman, he's a 60 years old gentleman. He is used to be a very good player, and he was a long distance swimmer. He developed hypertension and diabetes a couple of years ago. And unfortunately, he had one stent 6 months back due to coronary artery disease. Now, currently, he is completely asymptomatic. His heart function is fantastic. Ejection fraction is 65, and he has no arrhythmia at all. So he's asking you in the clinic, can I go, doctor, to play again? Can I go back to swimming? And you have to answer this question. And to answer this question, you have to check the following. What are the type of sports that he wants to join? What about his physical fitness? What about the risk factors? Are they controlled or not? So there is still we have ischemia, or his problem was completely resolved. Does the patient have arrhythmia or not? And what about his ejection fraction? So that's why we have to send this patient for a treadmill stress test. Or if he cannot do a treadmill stress test, we can do an imaging technique, like, for example, a multi-slice CT or stress thallium. And if this patient is having no symptoms, as we said, ejection fraction is more than 50%, and these tests are completely normal, so we consider this patient as a low-risk patient, so we can let him go back to swim again. And that's why the patient will be quite happy with you. But if these tests are not completely normal, so we have to go for a coronary angio. And depending on the coronary angio results, he might have a lesion. So what about these lesions? Is it a low-risk lesion, so we can leave it with a medical treatment? And in this case, this patient might go back again to swim. But if these lesions are quite tight, like, for example, having more than 50% in the proximal LAD, or he has multivessel disease, or he has a left main disease, so in this condition, we have to go for a stenting first. And remember that this patient had a stent 6 months back, and he has nothing at all, so we can let him to go back. But if this patient is having a recent coronary problems, and we go again for coronary angio, and we found a high-risk lesion, so we have to do a revascularization. And if he is, after revascularization, has no more symptoms, we can let him go back to sport. If not, he has, unfortunately, to avoid all types of vigorous exercise, include long distance swimming. So now, this is the guidelines, as we said before, that he has to go for an exercise before joining any sport. Let's give you another example that you might face in your clinic. This superwoman, or this is a 65-year-old lady. She is known to be dyslipidemic diabetic, and she's a smoker. She came for a regular check. She has no symptoms at all. She wants to join the gym to improve her physical fitness, and she has no chest pain. But she did a treadmill test, which was positive for ischemia, means she has a coronary artery problem. She went for a coronary angiography, and she was found to have a slow flow phenomena without any stenosis. As you can see in this video, the artery is very well open, but the flow is quite slow. So we named this problem as a slow flow phenomena, as we mentioned before. You can see clearly how long it takes the blood until it reaches to the end of the artery. It's quite slow. So what we're gonna do with this? This is we call inoca, or ischemia without any obstruction. So actually, this lady has to start medical treatment, including the aspirin and statin. And if after medication, we have to repeat the test again for her. If the test is completely normal, so this lady can go to the gym without any restriction. But if the test is still abnormal, we have to, unfortunately, to tell her avoid any vigorous exercise. So what about the acute problem, like unstable angina, STEMI, or non-STEMI? The most important or frequently asked questions, doctor, when shall I go back to sport after I got an MI or I had a BCI or CABG? This is very important question that you frequently ask it in the clinic. So the first thing that you have to tell your patient that you have to go to sport as soon as possible, because this reduces the mortality. It reduces also the number of readmission and anxiety. And you have to be referred as soon as possible to an exercise program, and you especially after the discharge for at least 2 to 3 months. And you can extend this program to 3 to 6 months if it seems appropriate. So what about medication? Any concern? Because I'm taking now an antiplatelet like aspirin or Plavix or Brilinta. Of course, yes. If you are receiving one of these antiplatelet treatments, you might be liable for bleeding. So you have to avoid any vigorous exercise that you might have any kind of trauma. So now we will discuss the last problems, which is abnormal origin of coronary artery. And we have different types of these anomalies. And this is the first one where the LAD is anterior to the pulmonary artery, or it's posterior to the aorta. One of the most dangerous one is between the aorta and the pulmonary artery. Or the second dangerous one is the interseptal, where the artery is running inside the muscle. So the prevalence of this problem is only 0.4%. And this problem might be the direct cause of sudden cardiac death in young athletes, especially if it's below the age of 40. And the symptoms of this problem is, in most of the cases, they have chest pain. They might have sudden unexplained syncope, especially with effort. Unfortunately, they might have a sudden cardiac death. And they might have no symptoms at all. And the first presentation is sudden cardiac death. And they might be completely symptomatic. So the exercise testing is very important to reveal ischemia. And this is the main diagnosis with the multi-slice CT is very important, can clearly identify the course of the LAD and which type of the anomalies, as we mentioned before. Here is a picture showing that the left main is running between the aorta and the pulmonary artery, which is one of the most dangerous types. So if I have this problem, can I go for a sport? And this will depend on the following. Which type of anomaly that you have. If you have one of these two types, avoid vigorous exercise for sure. So if you did a treadmill test, there is an ischemia or not? If you have ischemia, avoid vigorous exercise. So you can go for a recreational exercise, not a vigorous one. So as we can see here in class 3, that participation in most of competitive athletes with a moderate or high cardiovascular demand in individuals with abnormal origin of coronary artery with acute angulated. So you have to, especially for those who are having the type of anomaly that the artery is running between the aorta and the pulmonary artery. In this case, you have always to avoid vigorous exercise. And the last problem is the myocardial bridging. So what do we mean with myocardial bridging? As you can see in the left panel here, the artery is running on the top of the surface of the muscle, but here is a little bit inside the muscle, and here is markedly inserted in the muscle. So the artery is actually squeezed with each muscle contraction. So I'll give you an example of one of my patients. If you can see here, the middle of the screen, this artery is called the LAD, or left anterior descending artery. In the middle, you can see that the artery is squeezed with each contraction. And here are two different types, pictures. The one on the right side during the relaxation of the muscle, and the one on the left side, you can see clearly that the artery is very squeezed because of the contraction. So this is a very dangerous problem that might cause a huge problem in athletes. The same like as we mentioned before in the last anomaly, that if anybody has a significant myocardial bridge, he has always to avoid any vigorous exercise because that might lead to sudden cardiac death in these patients. So by this, we finished all the problems that might face the sportsmen or athletes during doing sport. So now I'll leave you with a take-home message. So I'll start with my take-home message that physical activity is not equal to exercise. New guidelines to protect a well-trained and old patient is quite important. Sport has a very good protective effect on your body, so it will improve the obesity, treat diabetes, hypertension, as well as ischemic problem. However, sport is not always risk-free because athletes might have sudden cardiac arrest or sudden cardiac death. Screening is very important before going to join any sports, especially for high-risk individuals. Soon we will have this guy available every hospital who is a sport cardiologist. That's my coach in the gym. And I would like to thank you at the end of my presentation. I will be very happy to listen to any question that you might have. Thank you.
Thank you very much, Dr. Islam, for this very, very interesting lecture. And I must say it was very nicely organized, and the take-home messages and many new things I learned as well. So let's see if the audience have any questions. I think it was a very, very well explained presentation. So you kind of must have answered all the questions, but we'll still see if anybody has any questions. I couldn't see any in the chat box. Well, go if anybody has any question, you can go ahead and unmute yourself and ask a question as well. Dr. Islam is here anyways.
So it means either one of two things. Either it was very clear so everybody understood it, or it's not understandable at all.
I think option A is better. I was trying to think of questions about the medications, and you answered it very well in the hypertension part. Because yes, this is a common thing. They come across in our internal medicine clinics as well. And as you said, now sports, it's this day and age, there are many young people who are going into athletes and all sorts of sports activities, and they do have these questions because they are asked these questions, I think, even when they start joining, that have you seen a doctor and have you gone for a screening? So
yeah.
It's good we have
Actually,
you,
one of the most important points regarding the medication and that you might face in your clinic, that especially for athletes who are doing vigorous exercise, like, for example, football players or basketball players, they are coming always with bradycardia. If they are, that's why you have to tailor the treatment according to the patient himself. So this is no one size fit all. So the point that if you have, for example, an athlete who is coming with a heart rate like 50 or 60, you cannot start beta blockers in this case. Even if beta blockers is very effective and very good for other people, it might not be very good for him. So that's why the treatment should be always individualized. According to I received one of he was a coach, he was an Italian coach. His heart rate while he's sitting in front of me is 50. So, and he has hypertension. So in this case, I will have to choose different categories other than beta blockers for him, because beta blockers will cause more bradycardia and he will be more symptomatic.
Yeah. Yes. So we have one question here from Dr. Ruba. Is using growth hormone or supplements would increase the risk? I believe she's asking the cardiac risk.
Yeah. Actually, we are receiving a lot of patients who are receiving either protein or testosterone or growth hormone, and which is in some cases it might cause like hypertrophy of the muscle, and eventually it will decrease the function, the pumping function of the muscle, or what we call the ejection fraction, over some years. Not only that, but it also has a very bad effect on the kidney as well. And this might be the leading cause of hypertension in the future, hypertrophy for the muscle again, and the vicious circle. So we always ask them, you are very happy with your body. Look at what happened to some of the bodybuilding players who, one of them died a couple of months back or a couple of weeks back because of this kind of supplementation. Because this is, these materials is causing just a temporary effect on the muscles. So he looks very well. His body is very well shaped. Once he quit these materials, his body is going back to normal. So it's a temporary solution. It's not a permanent one. So we ask all of them to stop permanently. If you want to take a regular or natural protein from the food supplementation, that's another thing to do. Most of them, they have a very high CPK level, and they have a very increase in the thickness of the muscle. And that's eventually will affect the function of the muscle over years.
Yes. I hope this answers your question. I couldn't see any other question at the moment.
I would like to ask the audience, everyone has to ask himself after this lecture for like the past 30 minutes or 45 minutes, if you are not practicing any kind of sport, are you willing to join or not? And what I also want you to do, if you are suffering of any heart problem before you might think of joining any kind of a sport, especially vigorous exercise, you have always to think about visiting a cardiologist or at least an internal medicine to make sure that your vital signs are fine, chemicals are fine, lab tests are fine, your heart function is fine before thinking to do this. But one more message for obese patients, because they always say, we cannot do sport because we are obese. Okay, this is a vicious circle. So you are obese, so you are not doing sport, you gain weight again. So you have to break this vicious circle by going to the exercise, even simple walking. As I said, also aqua fitness is very, very nice for obese patients because it carries your body weight in the water. So I think it's very, very important for everyone to think about joining sport if he's not doing it. Again, at least to go for 3 to 4 hours, as we said, the recreational sport or recreational athletes. 3-4 hours per week is not that much.
Absolutely. So you've given us another take-home message, a thought to ponder on tonight, that how are we going to change our lives? No, thank you very much, Dr. Islam. As I said, it was very refreshing and, of course, informative, and at the same time, waking us all up, because, yes, the amount, I can still remember the slide of the Big Mac and the and the squash. So, it's very easy to eat, but difficult to burn. So it's all about weighing and the risk and ourselves, understanding this and then explaining the same to our patients and to the community through our families. I believe, okay,
there's a very, very, very nice comment here from
Yes, yes, I just saw that as well. Yes,
I
we
think
all
that
will be the
our
patients.
PD income will increase now. Thank you so much. We hope so.
Inshallah, yes. So I believe we can end here. Thank you very much to the audience, and thank you, Dr. Islam, for taking out time from your precious schedule. I think we can call it a day. Good night, Masalam.
Thank you so much.
Thank you.